Hi again, and welcome back to ReHealth's YouTube channel. Today we're going to be looking at, is drug addiction curable? If you like our content and would like to continue to support us in our mission, please like the video and subscribe to the channel, and hit the bell notification button so that you never miss a video. Without further ado, let's get on to today's video topic. Is drug addiction curable? Can you ever stop having a substance abuse disorder? It's very common for people who are caught in a web of drug dependency to wish they could be cured of their addictions. However, this mindset alone shows a lack of understanding about the true nature of addiction as a chronic disease. Things can get tricky when we start to use the word cured when discussing addiction, because people can begin to let their guard down. The truth is that there is no cure for the chronic disease of addiction. Like a person with heart disease or diabetes, a person with addiction can't necessarily say that they have cured their illness, even if it's been decades since they've had a relapse. However, they can enjoy a long, consistent recovery that lasts for the rest of their life. Substance abuse treatment aims to counteract the disruptive effects of addiction on a person's brain and behavior to help them regain control over their life. This is a progressive, lifelong treatment plan. Recovery hasn't failed just because a person is relapsed. Relapses are part of the recovery process, the same way that a person with diabetes having a diabetic episode doesn't mean that a treatment regime needs to end. A person in relapse needs to reach out to care providers to help begin the next phase of recovery. While we can't say there's a cure for addiction, we can talk about what recovery looks like. A person in recovery will feel like they have their life back on track. They are pursuing hopes, dreams, and passions in life without the constant feeling that they need to lie, be deceptive, or revert to old habits. They also know that they have a support system in place by way of therapists, drug counselors, or social rehab groups if they feel the urge to relapse. A person in recovery will also have a toolkit of healthy coping strategies that allows them to react to stressful or triggering situations. How does a person get to recovery? For most people, the route begins with inpatient or outpatient rehab. Depending on the extent of the substance use problem, a person may need to undergo supervised detox in a medical setting before transferring to a residential setting. A complete rehab plan may also include things like cognitive behavioral therapy, group therapy, and long-term social rehab programs. While there's no cure for addiction, millions of people are living in recovery that enables them to manage the disease of addiction to live enjoyable, full lives. Well, that's all for this video. Did you learn something new today? Do you think that this information is helpful or could be shared with someone to help on their journey to rehabilitation? If so, please like this video and subscribe to the channel. And as always, feel free to share our videos to help us get our message out to those who need it.